Uh, Personality disorders, cluster B. 7. What is an antisocial personality disorder? Antisocial personality disorder has been known as a sociopathy, which is persistent betrayal by patients showing no emotional regard for what is moral and immoral. These people often ignore the feelings and emotions of others to the extent of antagonization and manipulation of others to get their own way. Finally, they show no regret or remorse for those actions. Treatment of antisocial personality disorder generally entails intensive long-term involvement with the patient. Therapy includes anger and violence management, treatment for substance abuse, but is difficult to do if the person does not admit to having these problems. These treatments are rarely, if ever, effective because the patient often will develop ways of using the system to their advantage. Even in a group therapy situation, a lot of these people will take advantage of the treatment that they're trying to get because of their disorder. It is chronic, but it has shown that symptoms diminish significantly as the patient gets older. Researchers have developed a program called Impulsive Lifestyle Counseling, which is a psychoeducational program targeted at those who would drop out of outpatient treatment. The efficacy of the program was supported in the study. Okay, so that was all for Cluster A. We're going to move on to Cluster B. Alright, we're going to be talking about borderline personality. Individuals with borderline personality disorder have a history of unstable relationships. They have difficulty interpreting reality and view significant people in their lives as either completely flawless or extremely unfair and uncaring. These alternating feelings of idealization and devaluation are the hallmark feature of borderline personality disorder, BPD. Psychotherapy, typically in the form of cognitive behavioral therapy, is usually the treatment of choice for borderline personalities. Dialectical behavior therapy has emerged as an effective therapy for borderline personalities with suicidal tendencies. The treatment focuses on giving borderline patients self-confidence and coping tools for life outside of treatment through a combination of social skill training, mood awareness and meditative exercises, and education on the disorder. Group therapy is also an option for some borderline patients, although some may feel threatened by the idea of sharing a therapist with others. Studies have found that the disorder usually peaks in young adulthood and frequently stabilizes after age 30. Approximately 75 to 80% of borderline patients attempt or threaten suicide, and between 8 to 10% are successful. If the borderline patient suffers from depressive disorder, the risk of suicide is much higher. For this reason, swift diagnosis and appropriate intervention are critical. So, 89, 8, 9. What is histrionic personality disorder? For people affected by histrionic personality disorder, self-esteem relies on the approval of others. Many experience an overwhelming desire to be seen and noticed, and this often results in behaving dramatically or inappropriately to draw this kind of attention. This disorder appears more often in men than in women, or more often in women than in men. Histrionic personality disorder is treated with psychotherapy that helps to uncover the individual's motivations that may be hidden behind their behavior. This kind of counseling helps them to relate to their fears in a more positive way. Medication is also used supplementally for helping treat symptoms of anxiety and depression that accompany this disorder. Recent research shows that women post more selfies of them or with a group than do men. They also made a statistically significant connection between women with histrionic personality posting more selfies than those who don't. That don't have histrionic personality disorder. Then they presented a discussion of social media related gender differences in how males and females present themselves. Interesting. Let's see. Finally, we have 90. And that is narcissistic personality disorder. NPD is defined more specifically as a pattern of grandiosity, exaggerated claims to talent's importance or specialness. In the patient's private fantasies or outward behavior, a need for consistent admiration from others, and a lack of empathy for others, perception and interpretation of the self and other people. Symptoms include intensity and duration of feelings, and their inappropriateness to situations, relationships with others, ability to control impulses. Low-functioning patients with narcissistic personality disorder may require inpatient treatment, particularly those with severe self-harming behaviors or a lack of impulse control. Hospital treatment, however, appears to be most helpful but is focused on the immediate crisis and its symptoms rather than the patient's underlying long-term difficulties. Psychotherapy is commonly used in higher functioning patients. Current studies have found that the best hope for prevention with NPD lies with parents and other caregivers who are close to children during the early preschool years. Parents must be able to demonstrate empathy in their interactions with the child and with each other. They must also be able to show their love for the children for who they are, not for their appearance or for their achievements. And they must focus their parenting efforts on meeting the child's changing needs as he or she matures, rather than demanding that the child meet the needs for status, comfort, or convenience. That's all of personality disorders, cluster B, and join us next time for cluster C. Thank you.